That's what I just, do all the stuff.
Well, trauma care starts with EMS in the field and proper triage and communication. We rely on our EMS a lot in that we want the most critical patients brought first, and we want them to accurately convey how sick the patient is.
Tell the ORN. Okay.
When it comes to patient management, it's a quick algorithm of managing airway first and making sure that they're able to effectively move air into their lungs, and then check breathing, their ability to actually exchange air within their lungs and breathe effectively and exchange oxygen, and finally to make sure that they're having an accurate amount of circulation and perfusion through their body.
I got one.
24-year-old male, 20-minute extrication.
We're good at trauma care and we're good at fixing critical injuries, but the real goal for trauma care is to prevent traumatic injuries. And no matter where you are, if you're at the best trauma center in the entire country and the entire world, sometimes people and patients are going to sustain injuries that are just not survivable. And if they are brought in dead or near dead, sometimes no matter what you do for them or no matter who you are or what your training is, those people are still going to die just because their injury is so massive. My first concern is to remain calm. I guess usually as the team leader, I'm looked to from the rest of the staff to remain calm and really give orders in a succinct manner. And if I am kind of losing and freaking out due to the nature of the injury, then my team is also going to freak out.
In a car seat. Yes. That'll be victim number 4.
And by far the times that I'm most emotionally affected are with
So victim 4 is going to trauma.
children, pediatric trauma. It's the most challenging to stay calm and stay emotionally detached from those when you obviously feel for the child, the innocent victim and the whole role. You try to do your job and give good trauma care and keep it together, especially for the rest of the team. And there's been more than a few instances that I've completed the care and finished my disposition of the patient and then gone back into the physician lounge and had 5 minutes to myself where I kind of broke down afterward. I feel that the lack of a trauma center in Northwest Indiana sets us back in medical care probably about 15-20 years. In that Chicago and Chicagoland area, there are as many as 6 trauma centers in the Chicago metro area. And you cross the border between Chicago and Hammond, and all of a sudden there are no trauma centers for miles, for at least an hour drive. And I think the care of the trauma patient suffers because the patient is injured in the state of Indiana instead of being injured a few miles away in the state of Illinois. But by having a trauma center here at Methodist Northlake, we can guarantee that Northwest Indiana can step into medical care as it should be in the 21st century.